You've been in therapy for 2 years, maybe 3, maybe longer. You can name your attachment style. You can tell your therapist exactly what your mother did when you were 9 that wired you the way you are. You can identify the precise moment in any relationship when your nervous system tips into hyperdrive. And you keep doing the same things. You keep choosing the same kinds of people. You keep texting first. You keep apologizing for things that aren't your fault. You sit in your sessions, articulate and insightful, watching yourself describe a pattern that you cannot, no matter how clearly you can see it, stop repeating. If you've ever quietly wondered whether therapy is actually changing you, or whether you've just gotten very good at narrating your own dysfunction, I want you to hear something. You are not bad at therapy. Therapy might be working exactly the way it was designed to work, and that design might not be enough for what you actually need. By the end of this video, you'll have 4 specific questions you can use to honestly assess whether your therapy is moving you or just narrating you. This is the first in a short series, so subscribe if you don't want to miss what comes next. Let me start with the most painful thing first. There is a particular kind of person who walks into a therapist's office and within 3 sessions has impressed the therapist with how self-aware they are. This person can identify their patterns. They can quote books. They can tell you what their attachment style is. They can describe their mother's emotional unavailability in a way that is almost literary. And they are not getting better. I want to name this honestly because I have been this person, and maybe you have too. We have built, over years of self-reflection, an extraordinary internal library. We have a taxonomy of our own dysfunction. We have language for everything. We have so much language that the language has started to do something the original feeling was supposed to do. It makes us feel like we're handling it, like the seeing is the same as the changing. It isn't. Insight is not transformation. Insight is the appetizer. And most people in long-term therapy never get to the meal. Now, before I go further, I want to be clear. I am not anti-therapy. Therapy has saved lives. Therapy has saved mine, in some sense, more than once. But there's a specific kind of stuck that happens when the modality of therapy you're in does not match the kind of wound you have. And attachment wounds, the kind we talk about on this channel, are a kind of wound that most standard talk therapy was not built to heal. To understand why, we have to talk briefly about what attachment wounds actually are and where they live in you. The dominant forms of therapy in the West today, cognitive behavioral therapy, talk therapy in its most common forms, even much of psychodynamic work, were largely developed to treat conditions like depression, anxiety disorders, phobias, and cognitive distortions. The premise underneath them is, more or less, that if you can change how you think about something, you can change how you feel and how you behave. Identify the irrational thought, replace it with a rational one, practice the new behavior. Outcomes improve. For a lot of conditions, this works. For attachment wounds, it works partially, and then it stops working. Because attachment wounds were not laid down by your thoughts. They were laid down before you had thoughts. Think about that for a second. The blueprint for how you do love, how you reach for people, how you experience distance, how your body responds when someone you need pulls away. All of that was wired in before you had language, before you had narrative, before you had a self that could think about itself. The wiring is in your nervous system, in your vagus nerve, in the limbic structures of your brain that don't speak English, or any language.
You can sit in a chair and have a brilliant conversation with a therapist about this wiring. The wiring will not move. The wiring did not learn through conversation. It learned through repeated experience of an unavailable parent, of a chaotic environment, of a love that came and went without warning. To unlearn it, you do not need a more accurate story about it. You need a different experience. This is the first hard truth. Therapy that is purely cognitive, therapy that consists primarily of you and another person talking about your patterns, will give you understanding. It will not by itself change you. Understanding lives upstairs, in the brain. The wound lives downstairs, and the staircase between them does not run in the direction you've been trying to send the traffic. Now, let me describe what this looks like from the inside. Because if you've been in this kind of therapy, you may have been told or may have come to believe that you just need to keep doing it. That insight will eventually translate into behavior. That the cognitive work is laying the foundation. And maybe it is. But for many people with attachment wounds, the foundation gets laid and laid and laid, and no house ever gets built on it. Here's what that looks like. You become extraordinarily articulate about your own dysfunction. You can give a TED talk about your patterns. You can predict your own behavior. You can sometimes even narrate it as it's happening. I can see I'm doing the thing I always do. I'm literally reaching for him right now. I know this is the pattern. And then you watch yourself reach anyway. The narration does not stop the behavior. It just adds a meta layer to it. You are now a person who is doing the thing while watching yourself do the thing, while feeling guilty about doing the thing, while making a plan in your next therapy session to talk about doing the thing. This is not healing. This is becoming a more sophisticated version of stuck. If you recognize yourself in that, I want you to hear me clearly. The fact that you are stuck does not mean you are broken. It does not mean you are untreatable. It does not mean you are bad at this work. It means you have been doing the part of the work that's available to you, with the tools that have been given to you. And those tools are not the right tools for finishing the job. So now we need to talk about how you actually know. I'm going to give you 4 questions. Write them down somewhere private. Sit with them. Don't bring them to your therapist yet. Just answer them honestly to yourself. Question 1. Has anything actually changed in how you behave in relationships since you started therapy?
Not how you talk about relationships, not how aware you are, how you behave. If a friend who knew you before therapy and a friend who knows you now compared notes, what would they say has actually shifted in your real life? Not your vocabulary, not your insight, the actual things you do and the actual things you stop yourself from doing. If the honest answer is, I understand it better, but I still do it, that is data. That is not nothing, but it is not transformation. And you deserve transformation, not just commentary. Question 2. Do you feel safer in your body than you did when you started? When you're alone at night, is there more peace or just more accurate description of the lack of peace? When something stressful happens, does your nervous system regulate faster than it used to, or does it spiral the same way it always did, just with better narration? Real attachment work shows up in the body before it shows up in your speech. If your speech has changed and your body hasn't, the work hasn't reached the place it needs to reach. Question 3. Can you imagine being in conflict with your therapist? This one matters more than people realize. Can you imagine telling your therapist they're wrong, that they hurt your feelings, that you're disappointed in them or annoyed at them or angry with them? Can you imagine the two of you having a real rupture and working through it together and coming out the other side?
If the answer is no, if your sessions are too polite for that, if your therapist has never gotten anything wrong with you, if there's never been any friction, that is significant data about the depth of your therapeutic relationship. Real attachment work involves real relational moments. If yours has none of them, the relationship may be too smooth to do the actual work. We're going to talk much more about this in the next video because it's where most therapy quietly fails for anxiously attached people. Question 4. When you imagine yourself a year from now, Do you imagine yourself meaningfully different? Or do you imagine yourself with more refined awareness of being the same? Sit with this one. The honest answer matters more than the flattering one. If you imagine yourself in 12 months having more language for what's wrong, but not actually being different, that's the real signal. The real signal is that the modality you're in is producing more of itself, rather than producing you, transformed. If your answers concern you, I want you to take a breath and hear me on this.
You are not alone in this. Most people with attachment wounds in long-term talk therapy run into some version of this wall. The wall is not a sign that you are broken or untreatable or beyond help. The wall is a sign that the modality of help you've been using is doing what it can, and you may need a different kind of help to do what it can't. What you have built so far is not wasted. The awareness you have, the language you have, the understanding of your own history, none of that is going anywhere. That is the cognitive scaffolding that the next layer of work will need to stand on. People who skip the scaffolding and try to do deep, body-based relational work without any insight tend to flounder. You have not skipped anything. You have just hit the limit of what one kind of work can do alone.
There is another kind. There are several others, actually. And in the third video in this series, I'm going to walk you through 5 specific therapeutic modalities that were designed exactly for the kind of wound you've been trying to heal. Modalities that work directly with the body, with the nervous system, and with the parts of you that don't speak in sentences. But before we get there, in the next video, we have to talk about something else. There is a specific pattern I see almost every single time someone with anxious attachment is in therapy that isn't moving them. It's a pattern your therapist may not be naming, even though it's happening in every session. It's the single most important thing to understand if you want your therapy to actually start changing you. And if you've recognized yourself in this video, you will almost certainly recognize yourself in the next one. If this video named something you've been quietly carrying, leave a comment with the word "seen." That's how I'll know to keep making this series. And subscribe so you don't miss what comes next. Take care of yourself this week. Be patient with the parts of you that haven't healed yet. They've been waiting a long time for the right kind of help. And help is real. I'll see you in the next one.